This is a special edition of Late Night Health. I'm Mark Alyn. We're going to go to Washington, D.C. We're going to speak with Dayna Bowen Matthew. And I'm going to get her credentials and I'm going to get it right. She's the Dean and Harold H. Green Professor of Law at the George Washington University Law School. Great NPR station. We just at the school. She's a leader in public health and civil rights law, and she's held many public policy roles. She's got a new book out, and we'll have that between the two of us so you can see the cover. It's called Just Help, Treating Structural Racism to Heal America. Years ago, when I had black hair and not the color I have now, I did a series of videos aimed at the Black African-American community, the Hispanic community, and the Asian community, offering them information about health because these communities don't have access, generally speaking, to the latest information about health. Would you agree with that still?
I sure would. The only thing I would add, Mark, is that unfortunately information is not enough. We know that when we talk about structural problems like structural racism, the research tells us that just getting information to underrepresented or underserved communities is not enough because they lack the resources to implement that information. So you might tell them, for example, you and I had a lovely conversation about supplements and nutrition, right? So you might tell me, if I'm in some of those underrepresented groups, that I need supplements and I need to make sure that my diet and nutrition is enhanced so that I can have a healthy, long life. I can live out the fullness of my years. But if I live in a food desert or a food swamp, if I work 2 swing shifts back to back, right? If I have an income that's not a living wage, the information can't be implemented. And that's why we find with structural racism that even getting information is not enough. The structures have to be dismantled.
Well, it's interesting because I often get samples of products because of this show. And I look at the pricing on some of these. Nobody can afford them. Law professors, talk show hosts. I mean, they're expensive. And while they're probably very good for us, there has to be a way of getting them to people who need them, who cannot afford them. I think there's a company called, an organization called Vitamin Angels, and they do a lot of good work in that area. Let's talk about structural racism. What would be a definition of that?
Oh, thanks for the question. Structural racism has 3 characteristics. Some of us have thought of racism as something that happens at the individual level. I'm bigoted, I don't like you because of the color of your skin, your sexual orientation, your age, your ability. Structural racism takes that ideology that one group is superior to the other group and institutionalizes it through an entire society. That's what's meant by the word structural. The racism part, that hierarchical ordering of people that are more or less valuable, more or less inferior, more or less superior, has a second characteristic, and that is that it distributes resources and opportunity and power throughout the society. So once I arrange people in the order of their priority, then I give them the education, the employment, the wages, the nutrition, the housing, the safety, all of the resources of society I allocate based on those hierarchies. So that's what I mean by structural racism. Those are the 2 first characteristics. And the third, which is the contribution of this book that I think is different from other discussions of structural racism, third characteristic is that laws built it and laws can dismantle it. When we look at structural racism, I want to take residential segregation as an example. It could only happen because people passed laws to tell you to live on one side of the street and me to live on the other side of the street. We have oral histories that say, up until about 1910, 11, 12, 13, 14, 15, the early 1900s, people lived where they wanted to. Now, I'm talking about post-slavery, obviously, during the Reconstruction, But we needed people to go to their city councils and pass a law like the 1910 ordinance in Charlottesville, Virginia, that said you can't rent to that one, you can't buy if you're that color, and sort people up by law. To this day, it is those legal enablements that have created, preserved, and maintained structural racism. Those are the three characteristics, and what's hopeful about that is that the laws can also be used to dismantle structural racism.
I know that there's a community here in Southern California on the beach, and they have a terrible history of structural racism, where they would not allow certain people, to Blacks, Hispanics, Jews, to own property in that area. And a family built a home, a hotel, put everything into it, and they had to leave it. I mean, it's not fair. Why? Let's, we became friends just before we started this. So I'm going to ask, because I don't understand things. I had a friend in elementary school. I didn't know until 10 years later that he was a person of color. I swear, I did not know. We used to switch sandwiches because his mother would put horseradish on his bologna sandwich. I have not eaten bologna in 30 years. It was horrible. But he would like whatever my mother made. And we I'd go to his house, he'd come to my house. We lived in the same neighborhood. I didn't know he was different. I didn't. I guess my parents helped with that. Why do we care? I don't get it.
You've heard, Mark, I bet, the term that race is a social construct.
Yes.
That means that our society has constructed meaning to the differences between you and your friend that make us have to care. Now, if it wasn't for the fact that we have structured around this idea of race, which really is a very American idea, let me say, this idea of race does not translate transatlantically. Ethnicity does, but race does not. Color does, but race does not. So this is a very American invention. And at the core of this American invention is that people's lived experiences are vastly different because of what I said about structural racism. We allocate education, safety, food, housing. Now, you and your friends lived in the same neighborhood.
Right.
I dare say it was easy for you as young kids to see each other as the very same species, the human beings that you are, right? Race did not enter the picture. But I also would venture to suggest that race defined your friend's social experiences in ways that were distinctive from yours. It defined how much his dad and mom made. It defined his family history because of the health care that was available to them generation after generation. It defined their eating habits. It defined where their family was able to buy a house before they got to your neighborhood and what they had to do to get to your neighborhood. So let me say, my father and mother, I keep a picture of them right by my desk, in order to get me to the point where I could have this conversation with you, worked 4 jobs, 5 between them.
Wow.
And died before they were the age I am today. My father died at 49. My father died a healthy 49-year-old, but for structural racism, right? So I dare say your friend's family doesn't have the same structure as your family, because in order to get to the neighborhood where my father brought us so I could talk to you today, Esteem, to get your friend to that neighborhood, he had to work a different set of jobs at a different set of wages. He and his family had to live in more polluted neighborhoods than your ancestors did. The wages that he got, the stress of the job he had and the treatment he had at work. What happened to him when he drove down the street? If he ran a stop sign, his mother's stress level if he went driving and got stopped by the police as compared to your mother's stress level. These social constructs distinguished your friend's life from your life. And that's why race matters.
In the 20s, a lot of Black performers, Louis Armstrong, the jazz singer, I can't think of her name right now. They
Ella
moved.
Fitzgerald?
I'm sorry?
Ella Fitzgerald?
Not Ella, who I once saw in a market, in a, I must have been about 12 years old. I was with my aunt. We were in Hollywood, California. And there was a sale, I swear, I know this sounds funny, but it's an equalizing thing. They had a sale on underwear, women's underwear. And my Aunt Till brought me to this sale. I was so uncomfortable. But Ella Fitzgerald was there, and there were women of all kinds, big ones, little ones, Black ones, tall ones, white ones. I mean, everybody was fighting for this underwear. It was hysterical, but it was an equating thing to me as I look at it now. I mean, everybody wanted a pair of, I don't know, dollar cotton underwear, whatever it was. No, there was something else. Maybe I'll get her. Lady Sings the Blues was the movie about
Billie
her.
Holiday.
That's it. But they moved to Europe because they didn't have the success here in the US that they could have in Europe. So that's what you're talking about. I mean,
Oh, that's very much what I'm talking about. And since this is a show about health and health impacts, let me tell you something else that's equalizing, like the underwear sale. The adverse effects on health due to structural racism. It's equalizing in this way, Mark. Black people, white people, Asian people, young people, old people suffer the adverse health impacts of racism. Not at the same rates. So we have studies that show, for example, that if you look at the Google searches for the N-word in a county or in a state, in a geographic area, and you compare those places where a lot of people are searching for it, not because they're looking at hip hop songs, but because they want to be derogatory, with the health of people who are in counties where not very many people are making those searches. And we can count these things, right?
sure.
The rates of death due to heart attack are higher for Blacks and whites, much higher for Blacks, as you might expect,
Yes.
but higher for Blacks and whites. We can do that with infant mortality, right? So structural racism hurts us all. It hurts us all from a health standpoint. And if you're interested, I'll tell you, I think fundamentally it hurts us all from a much more foundational aspect as well.
Well, of course, I think we're both going to agree that the healthcare system is broken. I mean, period. It doesn't matter what, it's making insurance companies lots of money. We can talk about that at some time. I'm willing.
That's another time, yes.
Yeah, I think that I understand that. I mean, Black. Well, yeah, I'm going to say that people coming from another country, even if they've been forced to come to another country, they adopt the American lifestyle and of fast food, right? And it affects people differently. Now, if you have fast food on a continuous basis, besides gaining a lot of weight, not having a lot of nutrition, it does affect a healthy Black person differently than it does a healthy white person. They both have adverse effects, okay? And look, I love a Big Mac every now and then, just like everybody else. Not often, but once in a while.
I'll confess the same.
Yeah, but not on a regular basis, because
No.
we know better. But diabetes, hypertension in the Black community is at significantly higher rates than it is in the white community. And I don't know if that's because of education, information, or if it's a physiological thing. I don't know.
We know a lot about why the differences exist. There's something called the social determinants of health. I know you and your listeners know all about this. But when we look at the percentage of impact of social determinants over genetic, biological, even behavioral determinants of health, things that matter to how healthy a population is, it is that social and environmental context that has the largest impact on whether you're healthy or not healthy, right? So it's not just the behavior of whether you eat the Big Mac or not. That has about a 10% influence. Your genetics, rather, let me start again. Your genetics have about a 10% influence on how healthy you will be, right? Your access to healthcare, whether you get clinical access to clinical care or you have insurance, that's another 10%, both very small, much smaller than we would have thought, right? But where you live, work, eat, and play, not just whether you eat a Big Mac, which has health behaviors, about a 30% impact, but where you get that Big Mac and where you consume it, that's the biggest influence. Why is that? Well,
Yeah.
I think it's for a number of reasons. Let me start with this. You know the Hispanic paradox, of course, which says that immigrants that are coming to this country was originally articulated for people coming from Central America. And so it's called the Hispanic paradox, but it's true for lots of immigrant populations. They may be poor, they may be low-wage workers, but they come to the United States and amazingly have better health outcomes than Americans who are white and wealthy, so long as they don't stay here.
Aha.
The longer that they stay, the paradox reverses and they become as unhealthy relative to white wealthy populations as other minority populations or minoritized populations. So the paradox is you can be poor, you can be low wage, you can be an immigrant, but you're more healthy than white wealthy Americans as long as you don't stay. The secret, I think, to why the paradox reverses is the answer to your question, which is why these populations are disparately affected. And it's because of the social environments that they are placed in because of structural racism here in the United States. So you may arrive a healthy Latina or Latino from Central America, but you live in a neighborhood that is close to approximate to pollution. You live in a neighborhood that has plenty of Big Macs, but no place for you to grow your own vegetable. Your kids go to school and they're undereducated. You're over-policed, and so you're afraid of your safety, and violence characterizes your life. And when you go to work, you work in conditions that remind you that you are other, that you are an outsider. And what the research tells us is that that weathering the environment takes a toll on health disproportionately. So that, Mark, and I'll give you this last data point. A mother who is Black, college educated, and middle income, earning between $50,000 and $75,000 a year, is going to lose her baby 2 to 2.5 times more frequently on average in the United States and for mortality than a mother who is white, living below the poverty line with an 8th grade education.
Oh my, is that because of the way that mother is treated?
That is because of structural racism. The way that the environment, the social environment that the different communities experience. I think of these as very population level issues, but the reason I told my father and mother's story is because I wanted to personalize them, right? I wanted it to be an individual story that people could see a human being living, right? So my father, as I said, worked at one point 4 jobs and became overweight because working 4 jobs at one time means you sleep less than 4 hours a night.
Oh my.
Which means you are doing the kinds of things to your body that will heighten your health behaviors that are adverse. You're going to start drinking to medicate that. You're doing the kinds of things to your body that are going to heighten your chances for obesity. But also, we have to ask ourselves, why did my father do that? He did it because we lived in a neighborhood where if I had gone to the public school system, I would be much more likely to have ended up like most of my friends who went to the public school system, on drugs, in jail, or dead. Those of us that were educated in the South Bronx had a very different future than those of us who got out. And how do you get out? If you're Black and poor, if you're Latino and poor, if you're Asian and poor, in America, you get out by doing harm to your health. That's the difference.
You know, I have a story that bothers me a lot. Our former gardener, okay, Hispanic, admitted that he came across the border illegally. Former gardener, he has since moved on. He came across the border, and the story he told me was simple. First thing he did was he enrolled in a course, English, all right? I met him because the other gardener that I had could not read, and he was white. He had no education at all. He couldn't read the directions on a fertilizer bag. So he paid Felipe to do that. And finally he quit, and Felipe took over. And I know we're running out of time.
Sorry.
But he became a citizen, brought his parents in, went to school, became a contractor, and said, "Mark, I'm no longer a gardener. What tile work do you have, or what building?" You know, I didn't have anything for him. But he called me up one day and he said, "You know, I've got health insurance," and I went to the doctor. And the structural racism that you're talking about, he had an appointment at, say, 11 o'clock. He waited over 2 hours, and the doctor finally brought him in. And he said, "Doctor, I guess you had an emergency." He goes, "No, I just make all of you guys wait." So Felipe got up, walked out, and as many Hispanics do, he went to Mexico to take care of his problem. Cost him $8 instead of $50, and he got the condition taken care of. I wanted the doctor's name because I wanted him fired. He wouldn't give it to me. But
Mark,
that's a common thing.
That story is so powerful, and it is an example of, my first book was called Just Medicine. It talked a lot more about these individual interactions with clinical providers like the physician you're describing, but it is a powerful story from so many vantage points, because although I think your gardener's name was Felipe, went to Mexico to get his health issue resolved, his emotional, mental health was impacted adversely in a way
Absolutely.
that someone who doesn't have to put up with that kind of a overt racist societal view, doesn't have to put up with that, is not affected. So he came back from Mexico with one part of his health improved. But this is why the Hispanic paradox occurs. The longer Felipe is here, the more of these adverse environment experiences are going to pile on. We call it measurable by something called the allostatic load. We can look at your health impacts. If you're interested in this, the woman I think deserves the most credit for all of this work getting started is Alyn Geronimos. And Dr. Geronimos is at Johns Hopkins, and she came up with the weathering hypothesis. Felipe had to weather life in the United States. My father and mother died having to weather life in the United States, where these structural inequalities have been baked in by law. And I wrote this book with the hope that I could convince people throughout every industry and every walk of life that we can use the law to reverse structural racism, improve all of our health, and live up to our nation's ideal of equality and justice under law.
So when does Dayna Bowen Matthew run for office?
She does not.
Oh.
She does not. She's having too much fun talking to people like you, Mark, and hopefully impacting change on the ground.
I mean, anything we can do here at Late Night Health, let us know. The name of the book is Just Health, Treating Structural Racism to Heal America. It's an important book, and I think everybody needs to read it. Not to be too political, but do you think that this is changing now with the current administration? Will it, or is it too slow?
Change always comes too slowly from my perspective. I view an opportunity to change to be independent of the administration. I certainly have my preferences for one administration or another, so I'm not being coy about that. But the structures that need changing are larger than the president can change his or herself. Structures that need changing start with those ordinances that we talked about at the beginning of the hour. Your city government, your school board, your local administrators can start no matter who's in the White House.
Got it. Listen, Dr. Matthew, thank you very much for joining us.
It was my pleasure. Thank you for having me, Mark.
My
I enjoyed
pleasure.
our conversation.
Thank you.
Have a good afternoon.
Have a good day. Hold on one second. I'm Mark Alyn. This is Late Night Health.